Hi there, everyone. Here we're going to take a look at the 12 core functions of the alcohol and other drug of abuse counselor. We're going to break down each one with a definition and then the actual global criteria as far as what's required to fulfill that particular function. You'll notice that for the most part, there's a kind of sequence to how these go and how they would be used for practical purposes in a treatment setting with a client. And the very first core function is called screening. So this is the process by which we determine whether a client is appropriate and eligible for admission into a program. So here's where we say yes or no, basically, whether we should go further and actually this person meets criteria and looks like they'd be eligible for a full assessment and probably are appropriate for some type of level of treatment. So the old saying is that we screen out and we assess in. So when we screen, we're essentially trying to screen out people who would not be appropriate and don't meet the criteria to enter into a program. Screening is a briefer process, generally speaking, than assessment, and we don't use it for diagnostic purposes, but it does give us a really good indication of where somebody stands in terms of their substance use. So we are evaluating any of the biopsychosocial signs and symptoms of drug abuse that we see. We're trying to make a determination on whether they are appropriate to go into a program and if they meet all the criteria that that program would require. We're also trying to figure out if there's other conditions such as medical or mental health issues that are going to need to be addressed. And in doing so, of course, we always want to follow all the applicable laws and codes of ethics. The second function is called intake. So once we've made that determination in the screening process that somebody is eligible for services, we want to do the intake process, and this is really, we think of this as a lot of the paperwork and administrative things that we do that are part of that first initial assessment and really introducing the program to the client. So this is where we do all the required documentations like informed consent and client rights. We provide an overview of what kind of services happen at the program. I think it's easy to take this function for granted and to just think of it as a busy work kind of process, but it's absolutely crucial that the client understands what is being provided, even if you've done this 100 times before, to try to keep it fresh and try to remember that maybe this person has never been in treatment before, maybe they have no idea what to expect. They don't necessarily understand the rules and regulations, and they kind of need to know what they're getting into, and that's what the informed consent process is all about. So we answer those questions. We do provide the forms, but we make sure the client really understands them, including confidentiality rights and other rights that all clients have. So make sure that the client has all the information they need at this point. Next up, we have orientation, and you'll see there's a lot of overlap. So even though these are distinct functions, they can happen, a lot of them at the same time simultaneously. So during the orientation part, we are describing to the client what the goals of the program are, what any rules are that the client needs to follow. And in particular, if you have a residential setting, there's probably going to be a whole lot of rules they may need to follow. So there's going to be some handouts and maybe some information that they need to understand what the expectations are, what the requirements are. If there are disciplinary consequences for any client behaviors, they need to understand those. You have to explain that to them. Let them know what hours services are available if it's a non-residential program. And you certainly want to cover the costs and how that's going to be accounted for during the process. Next, we have assessment, and assessment or evaluation is the more thorough deep dive into the client's biological, psychological, and social history, getting a sense of the client's strengths, weaknesses, what their main problems are, and what needs to be addressed during treatment planning. So always remember that assessment is not just to gather a whole lot of information and ask a bunch of personal questions of the client. We do all that so that we have a really good understanding of what's going on with the client, and that feeds into the treatment plan. So assessment feeds the treatment plan. The two really are nothing without one another. So we're gathering that relevant history. It's about alcohol and drug use, but it's not only about that. It's also about finding out their social history, finding out their work history, and very importantly, trying to connect with the client. So sometimes I describe to people the dilemma in the assessment stage is connection versus collection. And the connection piece is that we still want to show empathy, build rapport with the client, use all of our good person-centered counseling skills. And at the same time, we're probably looking at a form that's very long and requires a long time to complete and has dozens of questions on it that we want to answer as quickly as possible. And so that's the collection piece that we need to do. But if we lean too hard toward that collection, the client can very easily tune out of the interview and shut down and either provide false, inaccurate, incomplete information. And then that's not going to be very useful in the end for coming up with a good diagnosis and a good treatment plan. So we want to make sure we are spending some time also connecting with the client, developing some rapport and building trust. Again, understanding that this may be the client's first experience ever with any kind of mental health or behavioral counseling, or the first time with your agency, and they need to feel like you're listening to them and connecting with them. Once we've gathered that information from the assessment, we have a good sense of the client's history, an accurate diagnosis, and what should be addressed during their treatment stay. We collaborate with the client, share the issues that we have seen during the assessment, and then we try to come up with a reasonable plan for what we're going to work on. And the client should be very much involved in this process. It's a collaborative process. So what are we going to focus on, short-term and long-term, and what are some ways we can reach those goals? So you talk to the client about what you came up with in the assessment, identify the major problems that seem to stand out that need to be addressed, and then you actually formulate a written plan where you include those goals and you include specific actions that the client is going to engage in to reach those goals, and that's the treatment plan. Another critical function is called counseling, and this can be with individuals, with groups, as well as with family members and significant others. So we're providing a counseling approach based in a particular theory grounded in a research and evidence-based model. And we're applying the techniques that we've learned to help that individual or group to solve the different problems that they are at your program for. At all times you want to be considering cultural, gender, and lifestyle differences that may exist and making sure to address those as appropriate. And of course, you're always interacting in an appropriate manner with the client, with their family members and significant others. So that's where you want to rely on your rapport building and your person-centered counseling skills at all times. And counseling is really the means by which we're implementing the treatment plan. So we're making sure that the client follows through and completes those goals that we set. Next up, we have case management. These are the different activities we do to bring together all kinds of resources and support to help the client to establish and reach their goals. Really, no matter what your job title is in the helping fields, if you're involved in social services, if you're involved in substance rehabilitation and recovery, you are a case manager. You're going to use case management skills. You're at all times going to try to identify client strengths and then identify areas of weakness that may need additional support. So you need to understand your community and what kind of resources are out there, help coordinate those services for the client. And of course, this can be all kinds of things. This can be medical issues, transportation, finding medication, helping with employment, with housing, with vocational rehabilitation. So you need to know your community and all those different resources that the client can access, and then work with the client on making sure that they're getting the best care and addressing all of those issues. We also have a function called crisis intervention. So this is what we do when we are responding to a client who's going through an acute episode of emotional or physical distress. A relapse, for example, would be an example of a crisis. What we want to do is identify the elements of that crisis, make sure that we have an immediate plan to help stabilize the client, and then incorporate that crisis into the overall treatment, which can be an educational piece to help the client learn and implement new coping skills for the future. We also engage in the function of education, where we provide information to individuals and to groups and also to family members about alcohol and drug abuse. And so it's important that we are giving useful, accurate, updated, researched information. So when we're doing psychoeducational groups or psychoeducational functions one-on-one, that we're working from relevant and accurate sources and providing good and useful information. The function of referral involves identifying the needs that the client has that are outside of the scope of what the agency provides, and then connecting the client with those resources in the community. You can see how this would significantly overlap with the case management function. So we're figuring out what the client needs. Remember, we do the treatment plan, we rank and identify all the different issues and problems that we want to address, and understand that not all of those are going to be addressed during the treatment phase, and the agency may not have all of those resources. So we want to find what's available in the community and help the client connect with those so that once they leave our program, they can continue to engage in support that addresses those other issues. We do record and report writing. So this is our documentation. This is where we chart what's happening with the client. We include the assessment and treatment plan here, progress notes, our discharge summaries, our continued stay reviews. In working with interns, I found that the biggest surprise they have during the internship process as they're just getting started in the field is how much writing they have to do, how much documentation is involved. In some cases, documentation may be close to 50% of your job time, and some people find that shocking early on. Now, if you've been in the field at all, you probably won't find that surprising. What I try to do is get people past the mental block they have of thinking that documentation is not really relevant to their job or to their client. It's just busy work that gets in the way of the real helping process. And when it becomes too much of the job, I understand why people feel that way, and it certainly can be a huge burden on the counselor. And at the same time, I want to make the case that if we have an auditor come in, or if a file of ours is ever looked at by an accrediting body or potentially even by a court, the only evidence they have of anything that we've done is found in that record. They don't see the interactions we've had with a client one-on-one or in a group setting. They don't see all the wonderful work we've done. What they see is the notes that we've left, the treatment plan, and everything that's in the client's chart. So it's important that that chart reflects the excellent work that we're doing with clients so that other people can see that as well. And also that you're properly paid and properly recognized for the work that you do. Because if you've put in all this time with the client, but it's not documented, then it's like it didn't happen and it's kind of going to waste. So we want to make sure that our students coming into the field and our new employees coming into our agencies understand the importance of this function and are willing to engage in it in order to reflect the work that they're doing. The 12th and final function is called consultation. So this is also critically important. It's our interactions with our peers and colleagues, making sure that we are working together in order to formulate the best plan for working with a client. And because we need that supervision and consultation to make sure we're on the right track. Maybe we have a client with an issue that we haven't dealt with before or that we're struggling with, and we need feedback from a supervisor, from a colleague. So that's why we have case staffings. That's why we meet with colleagues and we talk about different issues, and we make sure we're getting the support and the resources that we need to be the best counselors we possibly can.